I'm looking at the economics of the preventative side of social care and concentrating on mental and social well-being in society. And for example, one of the research projects I'm looking at is on community capacity building, and those kind of projects are third sector owned community projects which operate on a kind of empowerment, or with empowerment, based on empowerment principles, and they're person-centered. And there is this idea, and it's suggested from initial or from more qualitative findings in literature, that they achieve cost savings to the public sector because they might meet needs when they arise and work more on the preventative side. So we are looking at this. We had some initial research looking at whether there could be cost savings to the public sector, and we find that potentially there are, but at the moment there are not enough data in that field, and because those projects are fairly small, they often struggle to collect outcomes data and even sometimes cost data. So we want to address that with our research, with one of our research projects, and collect some of those economic information. So we are working with those projects at the moment and collecting data. There's another area of research I'm looking at, again, like more in the kind of well-being, preventative side of social care and mental health, and that is concentrating on maternal mental health. So I'm looking at, in the past I've been looking at the economic consequences that occur to mothers, so mainly in form of quality of life losses in the first year after birth. And now we have some primary data that allows us to look from longitudinal study information that allows us to look at the consequences that occur to children of mothers who have been exposed to depression during pregnancy and after birth. I'm also doing some work on advocacy, and I'm working with projects, again, like in a field where there hasn't been much evidence so far, so there are not much data out there, and we worked with advocacy projects themselves who are concentrating on supporting parents with learning disabilities, often involved in child protection procedures, and support them during the process. And sometimes, or there is this idea that they sometimes might help to prevent that a child is brought into care, and therefore saving money to the public sector. So we're exploring that with our research, and we have some initial findings from case studies on that one as well.